Learning outcomes include defining the following terms: mentoring, preceptorship, simulation, self-mentoring, and mobile technology, to understand how the nursing shortage has resulted in insufficient mentors, collaborators, and preceptors across nursing education and the nursing profession, to consider factors contributing to the lack of mentors, collaborators, and preceptors across nursing education, and to consider in the following as teaching and learning tools: simulation, self-mentoring, and mobile technology. It is imperative that nurses are prepared to deliver high-quality patient care in complex, dynamic healthcare environments. However, there is a nursing shortage, meaning there are not enough nurses to mentor, collaborate, and preceptor nursing students and nursing staff, entering new clinical areas and assuming new roles. Alternative learning opportunities have been created to support nursing students and practicing nurses in their quest to become competent practitioners. Examples of alternative learning opportunities include simulation, self-mentoring, as well as mobile technologies.
For the purpose of this presentation, the following terms have been defined as the following. Mentoring. Mentoring is the act of engaging in mentorship. Mentoring is less formal than precepting and involves a long-term professional relationship between a novice nurse and nursing student and a more experienced nurse. Roles that relate to mentoring include teacher, advisor, role model, and confidant. Preceptor. A preceptor is defined as an experienced nurse who provides individual guidance to a student. It is a method used for teaching and learning in nursing education where nurses act as role models in the clinical setting. It is a one-to-one relationship that is limited between an experienced nurse and a novice nurse, designed to ease the nurse into a new role. Definitions continued. Simulation. Simulation is the imitation of some real thing, state of affairs, or process. In health professions education, simulation is a methodology to help achieve educational goals. Healthcare simulation encompasses a range of activities that share a broad but common purpose: to improve the safety, effectiveness, and efficiency of healthcare services. Simulation activities can include computer-based simulation, e-learning, high-fidelity patient simulators, role-playing, and other blended approaches. Self-mentoring. Self-mentoring can be an alternative or even a complementary practice to individual and group mentorship. A self-mentor is a person who is willing to take responsibility for their own development by seizing opportunities to enhance their professional abilities. Mobile technologies. The use of mobile technologies in higher education is the act of being able to learn anywhere and anytime with the use of mobile device that provides portability, internet connectivity, texting services, and access to applications that facilitate social media connection. E-learning platforms are a variety of referencing tools.
There's plenty of evidence to suggest that there are not enough nurses. The current nursing shortage is problematic as it is contributing to insufficient numbers of current and future qualified nursing faculty, reducing the number of available mentors and collaborators. According to Kramer et al., it is difficult to recruit enough mentors, which results in a lack of adequate mentoring and formal orientation for experienced clinicians who are transitioning into education roles. While the clinical environment is where nursing students learn their profession in action, there is a lack of clinical sites and qualified preceptors hindering nursing education. Undergraduate and graduate programs are having to turn away qualified applicants because of a lack of faculty, budget constraints, clinical and classroom space, as well as preceptors. There are a number of factors contributing to the lack of mentors, collaborators, and preceptors across nursing education and the nursing profession. There's been an increase in the demand for clinical placements for other professions, which has created great competition for clinical sites and qualified preceptors. A nursing shortage is due to the global migration of nurses and aging faculty, decreased satisfaction with the faculty role, as well as a lack of funding and poor salaries. The number of master's prepared and doctorally prepared advanced practice nurses planning to teach has decreased over the years. There is a lack of support for nurse preceptors. While supports are initially available, they taper off after the orientation period. Frustrated and overworked staff nurses may hesitate to take on nursing students if there are no supports in place. Educational institutions are limited by budget constraints, limiting their ability to hire nursing faculty, and a lack of time is a significant barrier to effective mentoring.
Simulation. Nursing education strives to prepare nurses who possess a combination of skills that include clinical judgment, critical thinking, problem solving, psychomotor skills, and clinical reasoning. Due to the growing concern for adequate clinical placements, the use of simulation is an ever-evolving potential solution. Safety is central to this learning technique as simulation provides a training zone for learners without posing any risk to patient safety. Simulation is a strategy that strives to merge nursing knowledge and practice in order to accomplish the necessary competencies in nursing education. There are many forms of simulation and each type serves a unique purpose. Some of these include partial task simulators, plastic models, screen-based virtual reality simulators, live or inert animals, human cadavers, standardized patients, and mannequin high-fidelity simulators. What does the evidence say? Various researchers have examined the effectiveness of using simulation, particularly high-fidelity simulation, otherwise known as HFS, for teaching nursing students. HFS involves a highly technological mannequin that closely mimics the bodily responses of a real human. One research study compared the effectiveness of simulation learning to traditional clinical experiences and concluded that HFS is acceptable as a replacement for 50% of traditional clinical placements. This study also concluded that 1 hour of HFS was equivalent to 2 traditional clinical hours. The HFS clinical setting has far less unexpected events, and students can progress through a simulation laboratory in a controlled amount of time, whereas actual patient encounters may involve more variables, which have the potential to require timely attention. Evidence continued. Due to the shortage of clinical placements, students will not necessarily observe or participate in all of the desired educational opportunities for each placement. For example, in a small hospital, a student may not witness a vaginal birth or a cesarean section while attending a maternity clinical placement. In a case like this, there are specific HFS that can mimic the real birthing experience and give students a more complete clinical representation of this event. Did anyone have the chance to view the video of an HFS birth in the suggested resources for this presentation topic? If not, I highly recommend that you see how this high-fidelity simulator works. While there is some debate on comparing the value between a simulated and real experience, providing a meaningful educational opportunity for students to learn regardless of the format has the potential to enhance the learning process. Has there been some resistance with simulation in nursing education? Of course there has. Some educators worry that it's not an adequate replacement for traditional clinical settings. That being said, there are several indicators for success of simulated learning, and some of these include knowledge and skills, safety, communication between the student and faculty interaction, clinical judgment, satisfaction, confidence, time on task, clinical evaluation, and feedback. Manningatire and NATO outline some of the reasons why simulation in nursing may not produce the desired outcomes. For example, having inadequate planning, training, and resources to implement simulated patient encounters are detrimental to consolidating knowledge and skills. According to the National League of Nursing Framework, having a faculty member who's an expert in simulation is paramount to the overall process.
Self-mentoring. Self-mentoring can be an alternative or even a complementary approach to individual or group mentorship. It was identified in the literature in the 21st century and has grown as a strategy for individuals to use when placed in new environments, such as a new role, for example. A self-mentor is a person, and this can literally be anyone of any age or profession, who is willing to take responsibility for their own growth and development. This requires a self-mentor to identify skills they are lacking and visualize their ideal self. They then seize opportunities to work on their identified goals, which may require the self-mentor to seek and invite the insight and knowledge of their colleagues. This brings about an important point about self-mentors, which is they do not always work in isolation, even though the term self suggests this. Self mentorship encompasses aspects of coaching, mentoring, and self leadership. Self mentoring requires 4 developmental levels, which are self paced and individualized. Each level builds on the previous. The first level is self awareness. This is where the self mentor identifies skills they are lacking and they determine they need in order to grow professionally. Self development and self reflection follow self awareness. These 2 levels require the self mentor to outline their expectations of themselves and develop a plan of action. Self-monitoring is the 4th developmental level. It requires a self-mentor to individually oversee their own progress. This could be done by way of Excel spreadsheet or even journaling as examples. Self-mentoring strategies. Self-mentoring involves various strategies for growth and development that all require the self-mentor to be proactive and motivated. Questioning and listening require the self-mentor to ask questions to enhance their own learning. Reading and researching is where the self-mentor seeks out knowledge by seeking references. When the self-mentor observes people, the self-mentor sets out to examine skills seen in others in order to emulate the behavior. Lastly, enrolling in educational programs combines the strategies already discussed. Self-mentoring and self-leadership theory. Self-mentoring is grounded in self-leadership theory. Self-leadership theory examines how individuals engage in self-direction and self-motivation through personal behaviors, natural rewards, and constructive thought patterns. Personal behaviors relate to the use of reflective techniques to manage behaviors. Self-observation is an example of a reflective technique that requires the self-mentor to engage in a higher level of awareness regarding their own performance. Natural rewards focus on changing one's perceptions of a task to enhance its rewarding aspects. In turn, this helps to optimize one's performance by increasing feelings of competence and self-determination. Constructive thought patterns focus on positive patterns of thinking. Positive self-talk or the use of mind maps can help facilitate constructive thought patterns, which help elevate one's overall mood.
Teaching with mobile technologies is another method that schools and facilities can use to overcome the barrier of limited experienced staff to mentor in the clinical setting. Mobile teaching with technology is a mode to provide learning materials, support, and guidance through mobile technologies in the clinical setting and is not constrained by the physical location of students and educators, thus making the use of mobile technology an alternative to educational guidance when mentors, preceptors, and clinical educators are limited or not available. Mobile learning can effectively increase nursing students' learning results. The use of mobile technologies provides several benefits as a teaching tool. The use of mobile phones has the power to decrease isolation in clinical settings by allowing students to connect with peers and mentors via text. Several different platforms can be used. Applications designed for this purpose are social media platforms such as Facebook or All Nurses. Integration of mobile technology and use of social media as a learning tool has been shown that post-education students routinize its use into their practice. Encourages students to be self-directed in their learning process and use their educator as a facilitator or a resource. Encouraged increased accessibility to educators, peers, and social networking groups while still remaining cost-effective. The implementation of mobile technologies in the clinical setting has come with several challenges. Not every workplace embraces the use of mobile phones. In fact, some completely discourage it. A risk to professionalism by misuse of technology while at work and improper taking of pictures. Do nurses understand how to use the information that is being provided to them? Regulating the protection of patient confidentiality. Currently, limited research is available. Educators who do integrate mobile technologies should consider adopting the following to mobile platforms, as they have been shown to be effective learning tools with the use of technology: inquiry-based learning, synchronous sharing, mind tools, project-based learning, peer assessment, game-based learning, and video sharing. As the crisis of limited mentors in the clinical setting continues, the embracing of mobile technologies is going to be an important factor in overcoming this barrier. So instead of restricting the use of technologies for the previously stated reasons, nurses should be educated and supported in the proper integration of mobile technologies into their daily practice. Nurses should also be taught critical analysis of information they are retrieving from these mobile devices, so proper implementation can be done. A study by Primer et al. Looks specifically at the use of mobile technologies in remote or resource-poor areas, and if they were used effectively as educational tools. The study looks at nurses in South Africa who have poor access to educational resources and often work in isolation. The following 5 themes were found in their results. 1. Authentic problem solving. Students were able to use virtual communities to build an on-site problem-solving group. Values the rapid and immediate responses online communities offered. 2. Reflective practice. Students were able to share case studies at a later time for group discussion and reflection, allowing for personal growth in their practice to occur. 3. Emotional support and belongingness. Increased comfort in seeking emotional support from their educators, often describing them as a second mother. Themes found in the Primer et al. Study continued. 4. Realization of unpredictable teaching situations. Some situations are hard to simulate as they are shaped by the natural events occurring to patients. Mobile phones allowed students to connect in real time to instructors when the unpredictability was occurring. 5. Lifelong learning. The phones became a central tool to them in continued learning as the student became more knowledgeable of the resources provided to them through the mobile technology. In conclusion, the study found that mobile technologies have the potential to support problem solving and reflection in the clinical setting. Mobile technologies are able to expand the resources that students have access to beyond those at the point of care in the clinical setting. In conclusion, throughout the past several years, nursing educators have become more creative in meeting the educational expectations of nursing students and practicing nursing, assuming new professional roles and skills. Simulations, self-mentoring, and mobile technologies are all learning and teaching tools which serve to meet the increasing demands on achieving the educational and clinical needs of students and practicing nurses. These learning resources are fundamental in nursing programs where clinical rotations are difficult to secure or they have been limited opportunities to exercise specialized nursing skills.